So the pandemics we are talking about here include COVID-19 and HIV, because the COVID-19 has had impact on the HIV response. So you find that during the COVID, especially the waves that we have experienced, a lot of people started also defaulting on their treatment. Some of them were not able to go to the health facilities to access treatment. So that created a problem for them and impacted on their health. And also during that time, you found that the medicines that were supposed to be here on time because of the lockdowns and everything, people had to be changed and put on something else, and others were affected differently, couldn't access that. So end inequalities, end AIDS. We are saying we cannot end AIDS if we do not end inequalities. And we cannot end AIDS if we do not end all other pandemics that are affecting and impacting on HIV.
And I'm glad you've brought that up, because we are living in a time of COVID-19, and this is something that has affected the world at large. And I'm happy you've highlighted some of the impacts, or how it's affected also the HIV situation across the world. But with that state still on COVID-19 and what has been happening, has this also affected the awareness programs that need to be there in the focus? Because it seems now people are focused on controlling COVID-19. Do you think this has kind of also overshadowed all the programs and awareness for HIV?
Well, of course, from COVID-19 point of view, yes, especially that we had to ensure that people don't get exposed, people stay at home. Most programs came to a stop because all focus was how do we address the new pandemic that has appeared on the block. So definitely the impact was there. Though in terms of government ensured that we did not stop to allow people to access, but because there was also the fear, if I go to a health facility, I might get COVID, so you stay back. And then also the fact that we couldn't have outdoor activities to raise awareness. Most of the programs slowed down. But I should say that despite that, we are picking up now. We are picking up because we have seen that we cannot keep quiet. HIV is with us, and if we do not address it continuously as we are supposed to, we will not meet our target, and it will affect everything else. And we have made significant gains in the HIV response. So if we drop our guard, it means that we will start moving backwards. And moving backwards, we will see us have increased new infections, which I should say in 2020, we noticed that infections started going up. So for us, we are saying we cannot stop here. We cannot slow down. We have to tackle both pandemics as they are with us, and we must make sure that the messaging from now onwards is together, integrated, so that we address both pandemics.